Cough is an important defensive respiratory reflex that tends to get rid of foreign substances through expelling them from the mouth. There are also diseases that are associated with cough, such as the upper respiratory tract infections, allergic rhinitis, asthma, or even chronic bronchitis. And also, cough might be initiated due to triggers such as the smoke, perfumes, throat irritation, noxious fumes, speech, exercise, and by humidity. Our throat and airways are equipped with cough receptors as well as thin layer of mucus that lines and protects our airways. When you inhale a trigger, our cough receptors will identify this intruder, which will get stuck in the mucus. Those cough receptors then send messages to our brain, which sends signal to our chest wall and abdomen in order to force a cough to get rid of foreign materials out of the airways. The cough consists of three phases: the inspiratory, compressive, and expulsive. A cough starts with a deep inspiration followed by a closure of the glottis and forceful contractions of the chest wall, abdominal wall, and diaphragmatic muscles against the closed glottis. Mucus, cellular debris, and foreign materials are propelled out of the respiratory system when the glottis opens. Here are some of the diseases that might be associated with cough. The cough can be classified as acute, which has a duration of less than 3 weeks, and it's most commonly caused by viral upper respiratory tract infections such as common cold. Subacute cough, it has a duration of 3 to 8 weeks, and it's commonly caused by infection, bacterial sinusitis, and asthma. Chronic, which has a duration of longer than 8 weeks. The most common causes of chronic cough in adult non-smokers are upper airway cough syndrome, also known as postnasal drip syndrome, asthma, and GERD. Also, we have drugs that might be causing cough, such as the ACE inhibitors, which are very known of causing a dry cough. In addition, systemic and ophthalmic beta-adrenergic blockers may cause cough in patients with obstructive airway disease, asthma, or COPD. Cough are described as productive or non-productive. The productive cough, it's a wet or chesty cough. It expels secretions from the lower respiratory tract, which, if retained, could impair ventilation and the lungs' ability to resist infection. Productive coughs may be either effective, which secretions are easily expelled, or ineffective, in which secretions presented but they are difficult to expel. A non-productive cough, it's a dry or hacking cough, are associated mainly with viral respiratory tract infection, but also atypical bacterial infection, GERD, cardiac disease, and some medication. Cough treatment is symptomatic. Underlying disorders must be treated to stop the cause of the cough. For example, if we have bacterial pneumonia, then the treatment must be with antibiotics. If we have GERD, then we must do life modification and acid suppressive therapy. And if it's the upper airway cough syndrome, then we can use decongestant. Antitussives, which are cough suppressants, control or eliminate cough and are the drugs of choice for non-productive cough. Antitussives should not be taken by patients with productive coughs unless absolutely necessary. Example, if the patient is having exhaustion from lack of sleep. Suppression of productive coughs may lead to retention of the lower respiratory tract secretions and potentially adverse consequences. For example, airway obstruction might occur or secondary bacterial lower respiratory tract infections. In other words, it means that if you have a productive cough and took an antitussives which lower the coughing threshold, so you will not be coughing those secretions, and those secretions will be stuck in your respiratory tract, causing problems such as infection. Protussives or expectorants change the consistency of mucus and increase the volume of expectorated sputum. Protussives are the drug of choice for cough that expel thick secretions from the lungs with difficulty. Starting off with the treatment, we have the non-pharmacological therapy. Hard candies and other non-medicated lozenges or even medicated lozenges reduce the throat irritations and may decrease coughing. Humidifiers and vaporizers increase the amount of moisture in inspired air, which may soothe irritated airways. Humidifiers and vaporizers must be cleaned daily and disinfected weekly. Babies and young children to about 2 years of age cannot blow their noses. A rubber bulb nasal syringe may be used to clear the nasal passages and reduce cough if postnasal drip causes the cough. Now, we've mentioned a lot about postnasal drip, but what is it? When someone is having common cold and he's suffering from rhinorrhea and all these mucosal secretions, they will be going from their nasal sinuses into their throat, which might cause cough, which we say postnasal drip. So this is what we call postnasal drip that causes cough. When a person is well hydrated, there will be less viscous and thus easier to expel secretions are formed. Most people need approximately 8 ounces glass of water daily. However, cautious hydration is recommended for patients with heart failure, renal failure, or other conditions potentially exacerbated by overhydration. Honey is the most common home remedy, but it should not be given to children under 1 year of age owing to the risk of botulism, as we speak in another video. As we mentioned earlier, antitussives are used for non-productive cough, and they include codeine, dextromorphan, and diphenhydramine. Codeine is the gold standard antitussive. It acts centrally on the medulla to increase the cough threshold. Antitussive codeine doses have low toxicity and little risk of addiction. The most common side effects are nausea, vomiting, sedation, dizziness, and constipation. Hydrocodone and hydromorphone have similar efficacy, but they are associated with a greater risk of dependency. Abuse of the combination of codeine and promethazine hydrochloride, known by the street names of lean and purple stuff, has been popularized by the hip-hop culture. Dextromorphan is a codeine analog, and it's considered approximately equipotent with codeine. Dextromorphan is a non-opioid with no analgesic, sedative, respiratory depressant, or addictive properties at usual antitussive doses. Dextromorphan overdoses cause confusion, excitation, nervousness, irritability, restlessness, drowsiness, and severe nausea and vomiting. Respiratory depression may occur with very high doses. Dextromorphan is abused for its phencyclidine-like euphoric effect. Dextromorphan blocks serotonin reuptake. The combination of MAO inhibitors and dextromorphan may cause serotonergic syndrome, which involves increase in blood pressure. Diphenhydramine is a non-selective first-generation antihistamine with significant sedating and anticholinergic property. Although diphenhydramine is an FDA-approved antitussive, it is not the first-line treatment. The antitussive effect is most likely related to its anticholinergic activity and not its competitive histamine antagonism. Second-generation antihistamines such as loratadine, fexofenadine, they lack the antitussive activity. Diphenhydramine's antitussive dose is lower than that of its antihistaminic dose. Now for the protussives, which are called expectorant, which are used for productive coughs. Guaifenesin is only FDA-approved expectorant, and it's indicated for symptomatic relief of acute effective productive coughs. It loosens and thins lower respiratory tract secretions, making minimally productive coughs more productive. However, few data support its efficacy, especially at non-prescription dosages. In addition, it's not indicated for lower respiratory tract diseases such as asthma and COPD or even smoker's cough. Their side effects may include nausea, vomiting, dizziness, headache, rash, diarrhea, drowsiness, and stomach pain. Data shows that the central cough suppressants are ineffective in cough associated with the common cold, and they recommend a combination of the first-generation antihistamine plus decongestant to treat the virus-induced postnasal drip that is most likely to cause the cough. The guidelines do not recommend guaifenesin for any indication. Now for the special population listed as pregnancy category C, drug dextromorphan is viewed by some clinicians as probably safe for use during pregnancy. Codeine, dextromorphan, and diphenhydramine interact with all drugs that cause drowsiness, such as narcotics, sedatives, some antihistamines, and alcohol.